I'm really interested to hear what our guest today has to say about this. Dr. Rob Gore, emergency physician from SUNY Downstate in Brooklyn. And Dr. Gore, I want to get a sense from you, first, of what your day is like, because you're in the emergency room, and then when your shift is over, you're going out and joining the protesters?
Yeah, my schedule has been a little bit crazy. Like last night I worked to about 7, 8 o'clock in the emergency department, and I went home and then started to plan what the next set of strategies were. Not necessarily for the protest specifically, but how do we create larger scale community change? And that's been happening. That's actually been my entire career. I don't think it's just limited to what's going on with the pandemic or what's been happening because of the recent protests that are occurring. This is what I've dedicated my life to doing. I don't believe that as a physician, as a healthcare provider, that the work that I do is only confined to the Department of Emergency Medicine. It's got to go above and beyond with the ultimate goal to ensure that the people we care for don't become patients. Why does there have to be an actual casualty? Why do we have to provide a Band-Aid approach in order for us to keep someone alive? If we're not looking at long-term causality, if we're not looking at the cause of the cause, then what are we doing?
And that's really the same discussion that we've been having about the NYPD, is scratch the surface beyond the incident you're responding to and try to figure out what led to the circumstances that would have caused that incident.
100%. When you just just commenting about the situation with the police department, you have to ask yourself, what is the police department protecting? Why are they protecting? And if the argument is that we want to make sure that the police department is supported so that people can protect their goods, my whole question is who are they protecting? Most people I know who commit crimes for whatever reason, they aren't doing it because of the sport. They're doing it to actually survive and to make a living for their family. They may have been marginalized. They may not have had the same sets of formalized education. And in order to eat, in order to sleep and find a place to sleep, in order to care for their families, they solicit ways and alternative forms of economic growth to provide for their families. So the question is, if the whole thing has been coming up about divesting funding in the police department. If you divest funding from the police department and create more programming for after schools, if you create more programming to provide economic opportunities for young people, because right now, like, summer youth employment has been disbanded for this summer because of the quarantine and pandemic. These are things that are more protective and can enhance the quality of life and well-being of individuals within the community, as opposed to just the typical, we're going to enforce a set of rules to ensure that a specific subset of people maintain their power and position.
And that's where you can draw the parallel when you say, let's look at the cause of the cause. When you shift from the NYPD to healthcare, for example. And when you try to drill down on the cause of the cause, and we see that it is much more prevalent, coronavirus, in communities of color. Talk a little bit about the cause of the cause, because we keep on hearing this comes from preventative care, not access to health care from early on. What are some of the things that in your life's work you've realized would help alleviate some of this?
Well, in the public health sector, there's something we refer to as social determinants of health. And these are the things that impact and influence our well-being. And this can run the gamut from education, economic development, social support systems, just to name a few. If you have a community that doesn't have proper economic development and they're low jobs, how do you afford food? How do you, if you have a school system which is considered to be inadequate, how do you train that particular generation to enter this new workforce that's constantly evolving? You want to ensure that communities are equipped to handle and adapt to current changes. And so all these different things, education, access to care, economic development, food access, social support systems, if you remove any of those elements from the equation, you have a compromised system. I remember, early on in the pandemic, when we were seeing high deaths, and even later on during the pandemic, we were seeing a lot of deaths, particularly amongst the African American, Latinx, and Native American communities, some people go, wow, I didn't realize that that was the case. Those of us who are from these communities weren't surprised at all. Those of us who live and work in these communities were definitely not surprised. If you can't afford medication, if you have an unstable living situation, if you have pre-existing health conditions, these are all excessive stressors on the bodies and can compromise your ability to fight off an infection. And so if each thing just adds and adds and adds onto it, which creates for a very dire situation that we all know too well. And so the question, I shouldn't say the question, the solution is to fix the systems that are important in maintaining quality of life and well-being for our most vulnerable communities.
And to that point, we do have to take a quick break, but when we come back, I want to talk about CAVI, the initiative that you founded to help at-risk students in Brooklyn. We'll be right back. You're watching One New York.
The same issues that affect our patients also affect me. Many of you probably don't know, but as a young black male growing up in this neighborhood and growing up in Brooklyn, we've had to walk around with identification cards. The earliest conversation I remember having with my parents about police brutality was when I was about 10. They said, you do not leave the house without some form of identification or some way to communicate with us if something happens to you. This practice has continued in my life for the past 30 plus years. I don't leave anywhere without an identification card. I don't leave the house without my medical ID badge. I don't leave without my Policemen's Benevolent Association card because people don't always assume that I am who I say I am.
That is our guest today on One New York, Dr. Rob Gore, emergency physician at SUNY Downstate in Brooklyn. And Dr. Gore, I saw in the piece that was done on you for CNN Heroes, which, by the way, congratulations for being nominated as a hero, that you said that you were robbed when you were younger and that affected you and stayed with you. Is that what led you in part to create this initiative called CAVI? And can you tell us a little about it?
That's a great question. Yes, I was robbed when I was about 10, 11 years old on the corner of our block. My bus pass was taken from me. I got beat up, and then I think I had $1 in my pocket that was also taken. But for kids growing up in pre-gentrified Brooklyn, and even currently gentrified Brooklyn, you're always concerned about your safety being compromised. I wasn't the only person that got jumped and got robbed. All of my friends, and we got jumped and robbed, and so it's almost like this rites of passage. But the last thing you want to do is nobody wants to feel vulnerable to the point that your safety is compromised. And seeing that happen to me, and then working in the emergency departments in Chicago and in New York City, we constantly saw this threat of violence happening in the community, and wanted to ensure that violence, particularly violent injury, wasn't something that was continued. I started looking at it from a public health framework after reading the work of a guy named Dr. John Rich, and recognized that violence itself, intentional violence, was an avoidable process.
And so tell us a little bit about the successes that you've had with that, and maybe some best practices or some lessons learned that you'd like to share that you guys have employed at CAVI.
So CAVI itself, for people who don't know who we are, we're a violence intervention program that's hospital, school, and community-based, and work with young people who are considered to be at risk for engaging in violence, which is almost every kid that lives in central Brooklyn. For our hospital program, we work with patients who've been injured due to violence because of the high rate of recurrence with violent injuries. 45% of patients who are injured are going to come back with repeat injuries within 5 years, and close to 20% will be killed within 5 years after an initial injury. And what we do with our school program, as well as our hospital program, is make sure that we're a support system for those who are in need. In the schools, we do workshops focusing on mediation and conflict resolution and life skills development. But really, it's a sanctuary and a space for young people to be heard. People are dealing with a lot of trauma, both at home and in the streets, and even in their schools. And the ultimate, the biggest thing that we want to make sure is that they have a space that they can articulate what their thoughts are and what their feelings are. Anyone who's been injured before has this constant threat of fear. Is this going to happen to me again? If it happens to me again, how am I going to come out? Is it going to compromise my sense of safety, my sense of well-being? Is my family going to be affected? And so we want to make sure that we're a support system for people who are going through those traumas.
We welcome your questions and comments for Dr. Gore. We've got a lot of different directions we could move with this conversation today. And one of the places I want to move after the break is into the hospital to find out how the fight against COVID-19 has been going in recent weeks. It's much better than it was 2 months ago, but it's not over yet. And there's more to talk about on that topic when we come back with more of One New York.
We are getting comments on Twitter and Facebook as people are watching live stream. Michelle on Facebook says, "Thank you, doctor. That's what I've been saying. It's a systemic situation beyond protests about the police, which need to happen. It's about the equity in healthcare, education, employment, and housing."
And we are joined by Dr. Rob Gore. And Dr. Gore, you are in so many ways at the center of what is happening in the city right now, working in the emergency room, speaking out in support of communities that have been disproportionately impacted, not only by violence, but also by this crisis. And then in the meantime, your pregnant wife at home, you guys were living separately for a while, and she owns a restaurant, and restaurants obviously are the industry that has been struggling the most. So how are you guys doing right now?
We're good right now. I'm back home, and in another 4 to 6 weeks, Junior's going to be here. We're not calling him Junior, but that's just what we're calling him right now until we figure out what his name is. But no, we're doing a lot better. The restaurant industry has definitely been affected by it. Business has been down substantially because most restaurants make their money by the sit-down customers. We have been fortunate to be able to have, serve meals through takeout services, but we do wonder, how long the business is going to be able to remain open if the situation doesn't shift.
So how did you sort that out when the pandemic was at its height? You didn't feel comfortable going home. You were able to find another apartment, so you didn't have the potential to bring the virus home?
Right. So when we had gone away for vacation, kind of like just our last hurrah before the baby came, and when we got back in town, actually before we had left, we started hearing about COVID-19 cases around the world in Wuhan, China, and also seeing the devastation that was happening in Italy. And she was already figuring out, she's like, if it's happening in these respective countries, it's going to happen in New York. And we're going to ensure that we have to make sure we start making amends and ensuring that the restaurant is going to be viable. So she took it a lot more seriously than I did early on. And then when the pandemic hit, I had the first couple of cases coming in the emergency department. Then soon after, just a few days later, a friend of mine got sick. He's my age, marathoner, has a family. And when he got sick and required hospitalizations because he developed an abnormal heart rhythm while being infected with COVID-19, I was wondering, am I going to be vulnerable to this as well? And every day there were more patients coming in, and they were doubling each day, and made the decision to go out to an Airbnb for a number of weeks. One of my other colleagues, whose wife is also expecting, had been sleeping on a yoga mat in front of the couch because his wife didn't want him sleeping in the bed or on the couch. And I told him, I said, I got an extra space in the Airbnb, and he came and we stayed in the Airbnb. Actually, we moved around to a few different places, but we were quarantined and away from our families for about 10 weeks, a little over 10 weeks.
But so I'm trying to put myself in the position of your wife for a second. She's married to a doctor treating patients with coronavirus. She's married to a guy who wants to go to the protests. She's pregnant as well. It's like the most stressful situations all combined. Have you thought about how you might make this up to her afterwards?
I know I'm going to be making this up probably for the next 20 to 30 years. And then even after that, we're going to bring it up. But no, I'm very lucky. My wife is supportive. She knows how important the community is to me. She knows how important health and well-being is to me. If we don't make these stands right now, whether it's through violence intervention, or mitigating the spread of COVID-19, or ensuring that there's a level of equity that exists within our community, it's not just someone else who gets impacted. These are our family members. These are our co-workers. These are our friends that are impacted. I live in Bedford-Stuyvesant. I work in East Flatbush. I went to elementary school across the street from my hospitals. And so the patients I care for are very dear and near to me, and I want to make sure that they stay alive.
We can certainly hear that in your voice and in your stories. Dr. Gore, stand by. We do need to take a quick break. Stay with us. This is One New York.
For the first weekday in 3 months yesterday, we did not have a Mayor de Blasio coronavirus briefing. He wasn't feeling well. We understand that the mayor is back at City Hall today, and when his briefing begins sometime in the next half hour, we will bring it to you live.
We will. And in the meantime, there's a lot of talk about what the city might look like when it starts to reopen. There's been lots of ideas floated about all different industries and what it might look like for dining out, for shopping. And then yesterday on The Daily, their science reporter, Donald McNeil Jr., was talking to Michael Barbaro, and he floated an idea about what he thinks the MTA should do, because his concern, and I think a lot of scientists' concern, is when you're in an enclosed space indoors with no ventilation.
I'm very worried about what's going to happen in New York City when a lot of people have to go back to work, because, you know, right now we've got near gridlock on the FDR Drive and stuff sometimes because a lot more people are in cars because they're afraid to go into the subway. But at some point, we're going to have to go back into the subway. And frankly, I think the MTA ought to take the windows off the buses and subways. I know it's crazy, and I know it's going to be cold in winter and hot and air conditioned in summer, but that's the way to get breeze blowing through enclosed spaces.
How public transportation will work is really the #1 question for when the city does fully reopen. We are joined by Dr. Rob Gore, who has been on the front lines of fighting this pandemic from the get-go at SUNY Downstate. Dr. Gore, what's your reaction when you hear comments like that?
I do understand, you know, there's so many people within this city that have to take public transportation to get to and from work, or even just to get to their families. And in order for them to survive, they've got to work. However, you are dealing with a very closed system. And the reason for the spread of COVID-19 in New York City, the reason why it was higher than in other parts of the U.S. is because you have so many densely populated areas. So I think, you know, if there is improved ventilation, and it's not going to be just opening up a window, because then that lets in all sorts of other dust and debris that we find in our train tunnels. But there is going to have to be some heightened awareness and some other mechanisms installed to ensure that proper ventilation is maintained, and you also minimize the spread of disease and other forms of debris that can cause respiratory problems.
Hey, Rob, take us into the hospitals now. It's not as intense a situation as it was a couple of months ago, but I'm curious what people are bringing to you as they come in with a possible COVID case. I'm sure they have a million questions. What are some of the questions that you do have answers to, and what are some of the questions you don't have answers to?
The one difference between back then and now is that, one, I think people are a little bit more comfortable wearing protective gear, but the one thing that is definitely common is the fear. People are fearful of whether or not they contracted the illness, whether or not they are still at risk for getting it a second time. They're concerned about the people who have been infected and were released, or had a loved one that was released from the hospital. They're worried about, are they going to have ongoing effects and impacts? I had a patient yesterday who had come in who was, had COVID-19 and diagnosed in early April and still having some gastrointestinal symptoms. He was stable, but still there's that threat and that fear. Is this going to cause me to lose my life? Like I saw people happening to people on TV. So the fears are very real.
And do you feel like we're better off now? Like when patients come in, do you feel like you have even though there's still so much that we don't know, do you feel like you have a better handle on how to treat people and how to guide people?
I think we are better off right now in the sense that there are at least protocols on how to enter and exit the hospital. We're, as a medical staff, we're comfortable wearing the personal protective gear. Patients are comfortable, or at least understand the need to wear a mask. In the early days of the pandemic, people were still trying to figure out How do we make sure we have enough equipment for everyone? How do we prevent the spread within this closed system? And how do we not get sick as healthcare providers? I think, we definitely have a lot more help in our emergency departments and our hospitals in terms of ancillary staff and nursing and nurses who are coming around providing care for patients. But it's still scary because we wonder, is there going to be another spike of what we saw back in March and April to the point that people are being impacted by epic proportion?
And when you talk about that fear, there's also the fear of contracting it that kept and it continues to keep a lot of people out of the hospital that need other treatments. There was a report on Bloomberg just the other day that thousands of cancer deaths are expected this year because people haven't been going in to get tested and to get treated. Are you seeing any improvement on that front now that the curve has flattened as much as it has?
We are still seeing a significant number of people who are coming with the exacerbation of long-term chronic problems like cancer, like diabetes, like uncontrolled high blood pressure. And the hospital is opening up to take patients coming in so they can maintain their regular follow-up with their primary care physicians. But the numbers still aren't as high as what we'd like them to be in terms of people having access to their primary providers. And so we will have more deaths that are ensuing. But this is another barrier to access to care that's existed in a lot of marginalized communities around the U.S. It just so happens that this is, people are the cause of people not coming in. With it, before it may be due to money issues. Now it's because of fear of contracting this particular virus.
Jamie and Annika, this won't surprise you, but I'm not particularly fearful about going into a dentist's office or a doctor's office because I know them. I have a relationship with them, and it's probably consistent with the way I've looked at this personally, trying to analyze what the risk is versus what the other side of the equation is. But there are a lot of people who have as you suggested, Annika, just stayed out of this equation entirely.
Yeah, there's a lot of people who stayed out of this equation and had remained home during the pandemic because they're a vulnerable population, and they might be a cancer patient on chemotherapy, advanced AIDS, or uncontrolled diabetic, and those are people whose immune systems can be compromised and don't fight off infection well. But every time, when you have your asymptomatic carriers, people who aren't as at risk to have the outright symptoms, those are the people who can pass on those infections to other people. We always have to keep in mind who are our most vulnerable, which is the situation with our protests, which is the situation with any sort of health inequity, and definitely the case during COVID-19. If we don't protect our most vulnerable populations, then there's definitely going to be an imbalance of power, and people unnecessarily going to lose their lives. So we have to ensure that we consider them in every single equation, particularly those who can't fight for themselves.
And going back to where you were talking earlier about the cause of the cause, because I want to drill down on that. You're saying we're talking about the more vulnerable people, access to health care or paying for health care. You also said that walking around those communities, you can tell that it is a less healthy population. And a big part of that is nutrition, right? I mean, you don't have the access. You have fast food restaurants and bodegas that maybe there's some fruits and vegetables, but it's not as easy to get healthy food in a lot of these communities. How much do you blame corporate America and the fast food companies, McDonald's, Wendy's, and so forth, for some of the problems that we're seeing?
I definitely blame corporate America because people are going to seek any opportunities to make money. And if you know that you're going to provide a cheap product to people who don't have as much money and want to be able to eat, you're going to target that specific group. There are more fast food restaurants. There are more liquor stores in our communities than there are healthy food options. Even in the direct vicinity of the hospital, we've got more pizza and fried chicken spots and fried foods than we do have fruit and vegetable stands and salad bars, which is a problem. And we're supposed to be at the forefront of providing healthcare and well-being and ensuring that our population is going to maintain that health, not just us patching up problems.
Dr. Gore, I want to take a short break. We're still waiting for Mayor de Blasio to come to the microphone. at City Hall, but we've got more of this conversation ahead on Wonder.
I am not going to allow situations to exist that we know have a high likelihood of causing an increase in the spread of the virus.
Our guest today on One New York, Dr. Rob Gore, emergency physician at SUNY Downstate. And I'm wondering, when you hear the governor say that and you see videos from around the city, you walk around the city, you go in and out of the hospital, and you see New Yorkers who are not wearing masks, I'm wondering, does that make you angry?
It makes me angry. I have this visceral response every time I see like a group of people who are gathered together with no mask or have the mask and it's covering their mouth and they're smoking a cigarette on the other side of it and coughing.
That kills me. That kills me.
And I know they're going to come to the hospital at some point, and I hope they're not taking that stuff to their grandmother or their elderly family member or their pregnant wife or pregnant significant other. But if behavior like this does continue, I'm almost guaranteed that we're going to see a spike in the number of illnesses. And then people are going to go, oh, wow, I thought everything was fine because the weather was warm. No, just because the weather was warm doesn't mean that, the disease stops being spread. Use a mask, stay at home, maintain proper social distancing, and just take these necessary precautions. It's not worth it.
It's a really good point. I mean, when you see that kind of video and you talk about the risks involved, what do you think we should expect going forward?
I do. Well, right now we're trying to figure out, are we going to see a rise in cases? Number two, as the weather gets hot, it's almost guaranteed that more and more people are going to go outside because people have been cooped up for the past 3 months. People want to get some fresh air. People want to see their friends and socialize because there's a lot of depression. There's a lot of anxiety, which I know is 100% due to the fact that we don't have our social support systems. But you have to ask yourself, what's going to happen more? Are you going to be impacted by depression more? Or are you going to be impacted by this disease process? And it's a hard line to be able to navigate. We just hope that people, when they do go out, that they maintain their social distance and maintain a sense of safety.
And so do you feel like New Yorkers are wrongly getting complacent with everything?
100%. We are definitely complacent. I think if you're not being impacted by a disease process directly, then you go, oh, that means I'm okay. And all my friends. It's no big deal. Fine. It's no big deal at all. But again, you have to look and see what happens behind closed doors. And you're not going to see the impact of the social distancing not maintained for at least another 2 weeks. This image right here with the police officer and the guy on the street, neither one of them had their masks on, and they were less than 2 feet away from each other. Those dudes are going to get sick if they haven't gotten sick already. I guarantee.
But so let's take this to the next step, because I think we're at the point where some social contact is what people have been craving. They've got a taste of it. No matter what the governor says, he's not going to get everybody to go back indoors when the weather is beautiful in June. So your advice, from what you know about how this disease spreads, what's the most important thing you do? If you're getting together with a group of friends, you're in a park, you're on a street corner, is it the mask use? Is it the 6-foot social distancing? I guess it's probably all of those things, but what would you prioritize?
Honestly, well, the first thing I'll use is the mask, because at least if you have a mask on, you can reduce the spread of those droplets going on to the other person. The next thing would be the social distance. The social distancing thing is somewhat of a luxury for people who live in New York City because everybody's in close proximity to one another. If we were out west in places that you have a lot of wide open spaces, it's easier to maintain, but at least wear a mask. And if it's not just for one person in the group to wear a mask, everybody in the group has to wear a mask.
Yeah, I've heard conversations recently that, look, if we protect nursing homes and the elderly population, we're fine, we can just get out there. And I think there are a lot of people who are looking for any excuse to say they're not vulnerable. But from what you were saying earlier with your colleague who got sick and your friends, it's easy to forget that this disease does not only affect a certain easily identifiable group of people.
So, I mean, with COVID-19, it can affect so many different parts of the body. It can affect the heart and cause abnormal heart rhythms. It doesn't really just have to, be a respiratory problem. We've seen people coming in with strokes. I've seen young people who were in their early 40s come in with strokes because of COVID-19. I've had colleagues who've died. I've had friends who've died from this illness. And some of them were older, some of them were younger. We've had young patients die who are under 30 years of age from this illness. So it's not necessarily just something that older people can get or someone who's immunocompromised. It increases their risk of dying from it if they have a pre-existing condition, but it doesn't necessarily just take them out of the equation.
Dr. Gore, are you wearing gloves outside the hospital? That's another thing that people have. Some people are more comfortable wearing gloves, not touching surfaces. Other people have not felt the need for that precaution.
Right. So I wear gloves when I go to the gas station. So I take a pair out of my glove compartment and I pump the gas and then I throw those gloves away. The problem with wearing gloves is that people assume that the gloves are going to be 100% protective, but they're going to push their glasses up like this. They're going to touch their face. They're going to scratch their nose. And if you've touched a contaminated surface, now you've just introduced the virus into your system, possibly. So I carry hand sanitizer. I keep hand sanitizer in my car. I keep it in my bag. So anytime I shake somebody's hand, and some people, forget that, we're not supposed to shake hands, and they do it anyway. So I go, hey, I'm proper. Then I squirt the stuff in my hands and then go about my business. But I do the same thing throughout the hospital. We wear gloves when we come in direct contact with patients. And then when we take them off, we throw them away. We don't keep reusing that same pair of gloves throughout the entire day.
That may be the first time I've ever heard the phrase glove compartment being used in the context of actual gloves, by the way. right?
That's just my...
Who keeps gloves in their glove compartment?
I am a glove wearer, and I will swear by my gloves, at least for the time being. We do have to take a quick break. Dr. Gore, stand by. We're going to get your final thoughts when we come back. You're watching One New York on Tuesday morning.